The cause of death was listed as an acute opiate overdose, pending toxicology results. The medical examiner disagreed with the preliminary assessment upon reviewing the comprehensive postmortem findings and laboratory data. The scene was processed by first responders before forensic personnel arrived, a sequence that mattered in preserving the integrity of evidence critical to the investigation. Initial observations noted signs consistent with drug use, but required further analysis for definitive conclusions. The deceased exhibited dilated pupils and respiratory distress indicative of opiate intoxication. Yet these symptoms alone were insufficient to determine the exact cause and manner of death without toxicological confirmation. Analysis of bodily fluids and organ tissues revealed a level of opiates far exceeding therapeutic thresholds, confirming a lethal overdose as the primary contributing factor. Further inquiry into the deceased's medical history and drug use patterns provided context for this toxicological finding, emphasizing the need for thorough forensic evaluation in such cases. Chapter: Case Background. The incident under investigation occurred on March 15 at a residential apartment in downtown Seattle. The initial report was made by a tenant who, upon returning home from work, noticed an unusual smell emanating from the deceased's unit. Upon knocking and receiving no response, the tenant alerted building management, who then contacted local emergency services. Emergency responders entered the premises due to concerns of potential health risks and discovered the individual unconscious on the floor within the apartment. Initial medical assessment indicated a loss of consciousness with dilated pupils and respiratory distress. The scene was marked by scattered drug paraphernalia near the deceased's person, suggesting recent drug use prior to their collapse. Given these circumstances, law enforcement was notified to secure the premises and initiate an investigation into potential criminal activity. Chapter: Initial findings upon arrival at the residence. First responders observed a scene consistent with a sudden and unexpected demise. The deceased was found supine on the bedroom floor, surrounded by various medications and paraphernalia associated with drug use. No signs of trauma were evident, such as lacerations or defensive wounds, suggesting no foul play had occurred. Initial medical assessment revealed pinpoint pupils and depressed respiration indicative of opioid overdose. The body's temperature was markedly low, consistent with prolonged exposure in a cool environment prior to the emergency services' arrival. The scene conditions were otherwise unremarkable. The windows and doors were secured without signs of forced entry or struggle. Given these circumstances, along with the presence of multiple prescription bottles containing opiate medications, further investigation by forensic toxicology was warranted to confirm the cause of death. Based on preliminary observations, the initial manner of death was classified as undetermined pending comprehensive toxicological analysis. Chapter: Forensic Investigation. At the time of the investigation, a comprehensive collection protocol was initiated to secure all pertinent physical evidence at the scene. Forensic teams documented and collected syringes containing residual drug substances, pill bottles with incomplete labels, and various drug paraphernalia including burnt spoons and small glass vials. Notably absent were any prescribed medications that would have indicated medical oversight or addiction treatment history. The deceased's personal effects were meticulously bagged and sealed for further analysis in the laboratory setting, ensuring a continuous chain of custody to maintain evidentiary integrity. Additionally, several digital devices were seized for potential forensic examination, which may provide insights into the procurement and use patterns of illicit substances. In the laboratory analysis of the deceased, comprehensive toxicological screening was undertaken to elucidate the presence and concentration of opiate compounds in various tissue samples. Gas chromatography mass spectrometry, GCMS, and liquid chromatography tandem mass spectrometry, LCMS/MS, were employed due to their high specificity and sensitivity for detecting opioids such as morphine, codeine, and oxycodone. The analysis included serum, urine, liver, kidney, brain, and lung samples to assess distribution and metabolism of the drugs across different organs. Histological examination revealed hepatocellular injury indicative of drug-induced liver toxicity. Microscopic findings showed evidence of pulmonary congestion consistent with opioid overdose, characterized by dilation of alveolar spaces. Quantitative analysis indicated serum morphine levels at 25 ng/ml, well above the therapeutic range and approaching the toxic threshold of approximately 30-40 ng/ml. Forensic evidence collected from the scene indicated that the deceased had ingested a combination of prescription opioids and benzodiazepines shortly before death. Toxicology results confirmed toxic levels of opiates in blood samples, corroborating this timeline. The postmortem interval was estimated using entomological analysis, with maggots at an early developmental stage found on the body. This method suggested that death occurred within 12 to 24 hours prior to discovery, consistent with time stamps from electronic devices and surveillance footage recovered during the investigation. The presence of prescription medication bottles and pill remnants provided additional context regarding the deceased's drug use history. However, the exact dosage and timing of ingestion remains speculative without clear witness statements or video evidence corroborating these events. The timeline established by toxicological and entomological analysis confirmed that death resulted from opiate overdose rather than other potential causes like accidental injury or suicide. In the context of this drug overdose investigation, the central finding of toxic levels of opiates in the deceased's bloodstream provided definitive evidence supporting a lethal level of intoxication. The forensic toxicology report indicated concentrations exceeding known therapeutic thresholds for commonly prescribed opioids and illicit substances such as heroin or fentanyl. Expert testimony would assert that these levels are indicative of an intentional overdose, given their magnitude relative to typical recreational use patterns. Interpretive elements include the presence of additional substances, which may have influenced opiate metabolism or exacerbated toxic effects. The expert would declare under oath that the toxicology results conclusively establish a lethal level of opiates as the primary cause of death, while noting the need for further analysis to rule out cofactors such as polysubstance use or environmental contributors. Interpretive elements include the presence of additional substances, which may have influenced opiate metabolism or exacerbated toxic effects. Chapter Resolution. The final determination in this case is a toxic level of opiates leading to an accidental overdose death. Initial evidence suggested a potential suicide based on the presence of prescription bottles and the deceased's known history of substance use disorder. However, thorough analysis of blood, urine, and vitreous humor samples revealed levels of oxycodone far exceeding therapeutic ranges, but consistent with unintentional ingestion due to misuse. The central finding was established through comprehensive toxicological screening, which identified not only the lethal opiate levels, but also metabolites indicating recent drug use beyond prescribed dosages. Forensic pathologists corroborated these findings with signs of respiratory depression and pinpoint pupils at autopsy, confirming a fatal overdose without evidence of intentional self-harm. From the initial assessment, the case shifted from potential suicide to accidental death due to the comprehensive toxicological report and subsequent medical examination. This change underscores the importance of thorough investigation in forensic pathology, highlighting how detailed analysis can clarify ambiguous circumstances surrounding substance-related fatalities. This investigation underscores the critical role of comprehensive toxicological analysis in identifying lethal drug levels and informing public health interventions. Accurate documentation and rigorous adherence to evidentiary standards are paramount for reliable conclusions. The file remains open,